For more on this, we're joined by Jerome Kim. He's the Director General of the International Vaccine Institute. Thanks so much for joining us here on the programme. First of all, Dr. Kim, is the flare-up of coronavirus in South Korea a second wave or the beginning of one?
So I think your second characterization is probably more accurate, that at this point it's an outbreak. And the goal of the government is going to be to try to suppress it before it becomes a true second wave.
And I want to ask you about the very strong words we've heard from the WHO, the warning saying that the coronavirus may never be eradicated and it may be endemic like HIV. You've worked extensively on HIV. Please give us all some reasons and facts to be optimistic with regards to a COVID-19 vaccine.
So as a scientist, I don't want to create unnecessary optimism. And I think that's what the WHO is doing. I mean, we have a lot of hope that a vaccine will be able to stop the infection, will be able to let us get back to the old normal, but we don't have any proof that it will. And so I think that as we develop vaccines, as we work, around the clock to try and get these vaccines to show a proof of principle in 6 to 18 months, we do have to recognize that we don't know all the answers. We didn't know all the answers 4.5 months ago when this started, and we know more now, but we still can't tell you how well the vaccine will work, how well it will work against some of the other strains that appear to be coming out in Europe and other parts of the world. So as we develop these vaccines further, we're going to actually have to ask some very clear questions about both the efficacy, that is how the vaccine will work, and its safety.
And in the absence of a vaccine, how do we live? What happens?
So that's a key question, because I don't think we can sustain lockdowns forever. I think what's become clear is that the countries that have been most effective in doing a lot of testing, doing tracing of contacts, have been those countries that have been able to emerge more quickly from the extreme lockdowns that were put into place. And I think that if you look at Australia, New Zealand, Korea, and other places that have been successful, there's a significant amount of testing compared to every case that is detected. And this reflects good contact tracing and then isolation of those people who are infected or who could potentially spread disease. I think this outbreak in Itaewon in Korea is a good example of how that kind of effort really may pay off in the end. I mean, we don't know for sure. It's still early days. But the idea that at this point there are over 120 people who've been identified as infected in this cluster, and they've identified potentially additional cases that weren't related to the original infection. So what this tells us is that active testing and tracing of contacts allows you to understand the epidemic, to get your arms around it, to begin to attempt to contain it. And short of that, we're actually trying, your public health authorities are trying to make decisions with incomplete information. And sometimes that can be dangerous.
And that's very concerning, incomplete information. Going back to what you said, to get your arms around the virus, we're seeing a very tense dispute taking place in the US between science and the economy. When, Dr. Kim, should you open up the economy?
So, again, I'm not in the United States, and I don't see the statistics that Dr. Birx and Dr. Fauci have access to. I think that they're basing their conclusions on their best judgment. Unfortunately, in these outbreaks, the responsibility of government officials is tremendous. And not only that, but they may actually have to make decisions or recommendations based on incomplete information. So, to the extent that they can look at the data that are coming out of the US CDC or out of the state public health laboratories, they're going to need to be able to make an assessment. Is it safe to open the schools? Is it safe to go back to malls? Is it safe to open bars and gyms? I mean, they're going to need to make these kinds of decisions. So in the United States, as opposed to other countries, a lot of the activities are actually accomplished by states. So if you look at New York or California or Texas or Georgia, you're going to see different types of outbreaks and different types of responses to outbreaks. unfortunately, for those of us who are actually don't have access or the privilege of looking at all the data directly, sometimes it's difficult because not all states are reporting the same thing, and that actually makes it complicates the task that public officials have as they're trying to make recommendations to the different states about what to do. I mean, in Korea, I think, and in other countries, it's been a very different set of command and control parameters. The prime minister chairs the committee in Korea, which means that the government is behind this. And it really is able to put into place uniform decision-making, uniform messaging, activities that are directed from the top are going to be accomplished and accomplished the way that the government had intended for them to be accomplished. So that way we can look at the numbers, we can look at the what's being done. We can look at the fact that the government was willing to change its mechanism for registering for tests, that you can do it anonymously. All these things because, there's a government, there are government officials, they're looking at data, and they're trying to understand how to make the system better.
Indeed. Dr. Jerome Kim, from Director General of the International Vaccine Institute, thank you so much for speaking to us here on TRT World. Really appreciate it.